My name is Ed Lunam, and I am part of the academic team with Aspen Dental Management, based out of Syracuse, New York, and been with Aspen for almost 2 months now. So just gonna here to help facilitate. Appreciate y'all coming out to take some time. We're just gonna talk about anything that you have want to know about day in the life of an oral surgeon. So Melissa, why don't you go ahead and say a few words?
Sure. So I'm Melissa. I'm with the academic team at Aspen as well, along with Ed. We're on the specialty team. So we work with endodontists and oral surgeons like yourselves. And we just, kind of spread the good word about Aspen. We're the brand ambassadors for Aspen Dental, the connection between Aspen and the academic world and the residency programs, just kind of letting you guys know what we're all about and what opportunities we have for you here. I have been with Aspen a little longer than Ed, coming up on my 1 year next month. So a little more tenured, but I still learn a lot from these things as well as you guys. So happy to have you on, and thanks for joining us. And Dr. Nazeeh, thanks for being here.
So hi everybody. Good evening, good day. I want to talk to you guys about my experience with Aspen, and then hopefully I can answer some or all the questions that you have. So, this year it's my 15th year with Aspen Dental. So I went to dental school in Vancouver, Canada. Then after that, I went and I applied for residency, and I got accepted and enrolled into an oral surgery program in New York, in Montefiore, Bronx, New York. And during my fourth year, I was busy finishing my requirement and finishing my chief year, but at the same time, I was interviewing and looking for jobs around. The fact that I came from Canada, so I did not have any connection to a specific place. And I remember one of my senior residents who graduated way before me and ended up joining a private practice in Rhode Island. During my fourth year, I received a call. And at that time, we did not have, we did have cell phones, but the phones were not well known to everyone. He calls me, and I'm sitting in the lab doing some orthodontic workups with my, residents. And he comes in and says to me, Nazeeh, you remember when I graduated, I went and I joined those private group. And I said, yes, I remember very well. And he comes in and says to me, no, I dumped those people and I left. So, and I said, so what are you doing right now? He comes in and says to me that he joined a corporate, he joined Aspen Dental. That was the first time I hear the word Aspen Dental. So I asked him, what was Aspen Dental? He comes in and says to me, Aspen Dental is a corporate dentistry. And this is how he described it. So, and I said, so I started asking questions. That was the first time I hear about Aspen Dental. How is it you're working with the general dentist? How is it you're working with corporate dentistry? At that time, he didn't have much knowledge because he just joined Aspen Dental. So months passed, and then he calls me back and he asked me about my interviews. And to be honest with you, I did go for multiple interviews. None of them kicked in. Certain ones had their own pros and cons. I wasn't convinced into joining anybody as an associate. And the only thing that I was gonna mention is just a moment. Somebody's calling. Okay. So the only thing that I was might be interested in opening my own practice. So then he comes in and starts to convincing me. He said, "Why don't you join Aspen Dental?" So I said, "Okay." So I'm interested of learning more about Aspen Dental. He did start explaining things more in details, and then he offered me. He said, "Why don't I have somebody from Aspen Dental calls you, and then you can ask more detailed questions," which is exactly what happened. So I spoke to a recruiter. She asked me if I can fly to Syracuse. At that time, the headquarters of Aspen Dental was in Syracuse. Right now, it's still in Syracuse, but we moved mainly in Chicago. So I said, okay, I'm willing to do that. They booked the ticket, and they sent me into a flight to Syracuse. That was, again, the first time I landed in Syracuse. And I went to the headquarters, and I met, at that time, the president and the CEO of Aspen Dental. That meeting kind of like really changed everything for me. Before, I was like, looking at Aspen Dental or working for Aspen Dental, like interviewing with any of the other people in, private practices in oral surgery. I also interviewed in some of those teaching programs. And I even got some offers from those teaching programs. So when I landed in Syracuse and I met the president, the CEO, and, the lady who picked me up from the airport, I realized there's something different about Aspen Dental. So I spent an hour maybe walking through the headquarters, and I went into different departments. And again, every time I go into a different section, I realize this is more than a dream. It's really real, Aspen Dental. After I scrolled through the headquarters, I ended up going to one of their main offices nearby the headquarters, and I met few dentists there, one owner. I met different people. I went into the lab, and at that time, to me, it really kicked in. That I said to myself, you know what? This is the first time I am really convinced. The other thing is, remember when I interviewed everywhere else, this is something we all as graduating resident or, even as a dental student, you always ask about compensation. So everywhere else, I realized that there was something more than compensation in it. I wasn't happy the fact that I have to work very hard throughout my first year after graduation with a fixed compensation, fixed salary. So somebody like me, I mean, I was like very energetic and I wanted to work. I wanted to produce. So I needed somebody or a system or a contract to compensate me. So Aspen was the first, organization that offered me a percentage based on my production. It wasn't a fixed salary. It wasn't, yeah, spend the whole year and come back and let's renegotiate your contract. They said, we will give you the work, we will give you the location, you produce, wherever you produce, this is your percentage. So you can work. I remember specifically, she said to me, Jennifer, if I may mention her name, she said, if you work, you can work 2 days and you can work 5 days. The more you work, the more money you will make. This is specifically. So I like this idea. I'm just about to graduate, start a family. So kind of like, I wanted, and I was like really ready to work. So I needed somebody to compensate me for that. And I realized from the Aspen offer, that it's really the best offer that I had at that time. So I flew back to Montefiore, and definitely I requested the contract. I received the contract within 2 weeks. I even ran it by my director. My director asked me, he said, do you want it or not? I said, yes, I want you to help me reviewing the contract, but I really want to join Aspen. So he said to me, it's a regular contract, go ahead, sign it, and done. And I did sign it within like 2 weeks, 3 weeks maximum from receiving the contract. And, I'm here working for Aspen 15 years later, so go ahead, Ed. Ed, do you want to ask a question?
Not so much a question. I was just gonna say, yeah, 15 years later, and with a crystal clear memory, all those details about the infancy stages and being courted by Aspen Dental and from the contract to the interviews and whatnot. So that's great memory, great story sharing with everyone on that. You mentioned the dreams with Aspen when you're interviewing. So let's talk about what makes, what goes into a day that makes those dreams possible. A lot of topics we want to go over tonight. Questions ranging from equipment to procedures, maybe some compensation, logistics. So, 15 years later, obviously you've seen a ton of growth exponentially with Aspen Dental. So let's just kind of dig into it specifically with our audience here, being oral surgery residents. Let's just talk about it. You can't perform oral surgery without equipment. So why don't you just talk briefly, if you would, a little about one of the questions that's come through here is, what is the equipment that Aspen provides you?
Okay, so, and this is not because I work for Aspen, this is from my own experience. Aspen, for new hires, and even I am somebody like me 15 years later or 15 years old, experience with Aspen. But for new hires, they have a big budget for new hires. So literally, when you sign the contract and you're about to start, let's say there's a fixed date for you to start, they will help you to do that. But if you want to do it on your own, it's fine. But with the many oral surgeons that we have a huge list of equipment, that you can order, suppliers. So you can do it on your own, or you can literally go into our website and sign up and basically look at all the available equipment, and you can order literally anything you want. Now, when I say anything you want, this could mean a lot of things, but with the experience of the purchasing department, they know exactly what oral surgeons and endodontists and general dentists basically need for their daily, work, production, and treatment. So to me, there is nothing. Even myself or any of the new hire oral surgeons, there is nothing that I needed that I did not get. So literally, any equipment that you think you need to perform your daily oral surgery procedures is available from Aspen. And even if it's not available at our website and purchasing department, you can do it individually and it will be available for you. So for the equipment, there is nothing that is not available, as long as it relates and belongs to our field of oral surgery. And, as I said, our purchasing department, they're very, very experienced with the oral surgery equipment and the ordering. So, if there is any dispute about any equipment, they might go back to somebody like me or any of the other senior oral surgeon and inquire about that. But with the purchasing and the equipment, there is, as I told you, there is nothing that I needed throughout my 15 years at Aspen that I did not get.
Dr. Nazi, a question that just came through on the specific subject of equipment, asking about who pays for the equipment, and if you cover multiple offices, which you do, are you or Aspen responsible to move the equipment from office to office?
Okay, so who purchases those equipment? The initial package, the starter package that you need to order to perform your regular oral surgery, procedure is covered by Aspen. So there is a large budget, and I'm not going to mention, figures because every state has its different requirement. So the budget is not the same from state to another, but it will be enough for you to purchase, like for example, when I started, I purchased about 6 or 7 cassettes, and I filled it with all the equipment that I needed, all the elevators, all the forceps. Then I purchased additional equipment, side equipment that I don't use in every case. I purchased, a striker, a drill, a monitor. So there is a budget, And when I say it's large enough to order anything you want to perform your daily oral surgery procedure. Now, the other question that was mentioned about the equipment. So, initially, I was responsible for transporting my equipment. The fact that, when I started, I had one and two dental assistants. They were inexperienced. So I needed to make sure this equipment are delivered on time, for my daily activities at different locations. But once I became familiar with my assistant, so my assistant carry almost like 80% of my equipment. The I like I li- so the only equipment that I carry right now is implant related, because implant related equipment, this is very important to me. I need to make sure I know the inventory of my implants and where, the all the tools available for implants. So this is the box that I carry with me, anything related to dental implants. But my assistant, they carry all my equipment, all my surgical, elevators and forces. Now, there are other, like for example, I have a main monitor and a spare monitor. So the spare monitor that I use it for recovery, or in case of my main monitor breaks. Now this is me, and this is the state regulation that I can carry. In certain states, you cannot do that. So, excuse me. So in the state of Florida, every office that gets inspected in relation to the anesthesia permit has to keep all those equipment inside. Whereas here, no. Once we pass, literally we can transport equipment from one office to another, as long as we're not transporting scheduled medication, okay, without a permit. But in a state like Florida, no, you can't. So obviously the budget for, if you're a starter or a surgeon in a state like Florida, your budget will be much higher than, let's say, somebody in my state of Connecticut or Massachusetts. So there is not a fixed kind of like limit for budget regarding, starter or surgeon.
And staying in this area of equipment, another question just came in regarding, you may have just talked on this briefly, but regarding medications and monitors for IV sedation, who purchases it?
So initially, the monitor will be part of your starter, order. Now the medication, and again, your first order should be covered by, Aspen Dental. So they will order anything for you to make it available to start. Now, subsequently, like right now, every 1 week or 2 weeks, I purchase additional medication. Now, we do share this. So this comes from my production. So every month I produce certain amount. The cost of purchasing those, medication and maybe IV lines and whatever comes from my production, total production amount. But I have to be honest and clear. My monthly ordering or purchasing, the cost does not even reach 1% of my production every month. So literally, 1%, less than 1% goes to cover those biweekly or monthly orders that I make to refill, medications, IV lines, gauzes, whatever.
Okay, great. So sounds like the equipment's there, the resources are there to provide oral surgery, to take care of patients. Let's shift gears a little bit. Let's talk about patients. Let's talk about oral surgery, and if you would, a little bit, Dr. Nazeed, talk about how many patients you're seeing a day, the procedures that you're doing, a typical on average, a typical day, if you will, of the life of an oral surgeon at an Aspen Dental office.
Okay, so this varies from one oral surgeon to another, from location to another location. So there are locations that are very, very busy, and there are locations that are not that busy. So in general, most Aspen locations are busy. Some of them are very, very busy, and some of them, busy. Now, like to me, it depends on certain offices. I go once a month, and certain offices I go twice a month. Obviously, the busier they are, so I go more frequently. I mean, like today, I literally I work every day from 8 until 5 and 8 until 6, sometimes even longer. But it's my decision. I may, decide how many hours do I work. But in general, let's say 8 to 5. I don't take lunch. I just don't want to take lunch because I like to continue working, and I don't want to pause in the middle. Some oral surgeon specialists do take lunch, but literally I average maybe every 45 minutes a patient. Now, my experience at Aspen, and this is all depends on experience also, I am able to accommodate a procedure every 45 minutes and a consultation every, sometimes an hour, sometimes every half an hour. So this is my pace, and I dictate that pace, no one else. So as I told you, in a busy day, I can see, more than 15 patients if I want. And a regular day, I might see 8 to 10. It's my call, and it depends on how busy the office and, the need for oral surgery procedure.
And I know you just said varies based on each office you go into, whether it's an existing office, 1 or 2 days a month, de novo, just getting started up. Um, Talk about the procedures that you're doing, if you would, please.
So basically, literally comparing myself to a lot of oral surgeons that are very close friends to me uh, in my neighborhood and in my area, in my state, who have their own private practice. Says I literally do every procedure that they're performing in the office. So anything related to dental alveolar, I am doing it. Now there are procedures that I myself avoid to do it. Like for example, TMJ. I don't want to do TMJ. It just I decided after many years that I decided I don't want to do TMJ. Now I used to cover hospitals and take calls. Not anymore. I am still an attending at one of the main hospitals in the capital of Connecticut, but I only leave it for emergencies. I am not seeing inpatients, and I'm not doing OR procedure because this is my decision. So I am not doing orthodontic cases. Trauma, if there is a need, for trauma, I might do it, but I, divide basically my daily practice that I am doing right now, dental alveolar. So anything from mainly wisdom teeth. So I do a lot of wisdom teeth. There are a lot of wisdom teeth patients. Full mouth extraction, we do quite a bit of full mouth extraction. Implants, the past 2 years, really the number of patients that I've been seeing really surged. I do not still know why, but all of a sudden I am doing more implants than, I'm literally, I can say like I'm averaging, maybe 5 to 6 implants a day that I'm doing. This is, I have no, how can I say, explanation why. It just all of a sudden we're busy doing implants. So, between wisdom teeth, implants, pre-prosthetic. I like to do pre-prosthetic surgery, so soft tissue procedures. So literally, how can I say, anything related to dental alveolar. This is what I'm doing on a daily practice.
Another question here on this line. It says, I know the Aspen model in that your patients are coming from the associates down the hall. Do you have to run treatment plans by the referring doctors?
So this is very important question, and the answer is, I mean, I really want to be honest with you. I do not run my treatment plan with the referring dentist, but we work together. So basically, we all have to be in the same page. Like in my situation, most, actually maybe all the referring dentists that I deal with are much younger than me, and they lack my own experience. But we work together, and this is very, very important, whether in private practice or Aspen Dental or anywhere else. They're not going to come and dictate the treatment. They're going to offer the treatment to the patient, and because you don't see the patient, you're not the first clinician to see the patient. It's the general dentist at Aspen sees the patient, diagnose the problem, and then come up with different treatment plan. Now, this different treatment plan also relies on your communication with the general dentist. So throughout the years and establishing good relationship with the general dentist, now this general dentist will know certain aspects of treatment plan, especially the one that you as a specialist like or can do. So the general dentist will present those treatment plans to the patient. If the patient decides, they're happy with one, treatment, usually they are referred to you. Now, at the time, at the day of the procedure, because I've known most of those general dentists for a long, long time, I rarely overrule their treatment plan. And actually, matter of fact, that they are in constant communication with me about different aspects. They email me, they text me about different aspects, as long as we, maintain the privacy of the patient. So there are rules regarding that. So when I see the patient, I have the full authority to agree with the treatment or disagree. But this is a teamwork. So I cannot disagree with the treatment and then change the treatment and decide I want to do the change treatment. At the end, we're all team. Remember, this is the patient of the office, and the patient is being referred to you by this general dentist to you as a specialist. So if I agree with the treatment, we're fine, we're all happy. If I disagree, then I will go back and have a discussion with the general dentist to see why I agree and why I may disagree with the treatment, so that we can come up with a better treatment plan that will suit this patient. Then we go back to the patient and we make sure the patient is in the same page, because at the end it has to be the referring dentist, you, the specialist doing the procedure, but also the patient. We have to be all together in it. If one person is not in it, then this treatment is not going to be done. And this is very important to protect all of us.
Another important question, I think, for an oral surgeon, which helps lead to their success, are the assistants, right? So this is a three-part question: is how many assistants do you have? Are they oftentimes the same assistants that you're working with, and what type of training do they have?
So how many assistants I have? So I have two full-time assistants that travel with me. They travel together in their car, and and we meet every day at a different location together. But every office that I go to has 3 to 4 to 5 different assistants. So those assistants will help my assistant to do accessory work, maybe sterilization. So my assistants are busy helping me doing the procedures. So somebody else might be seeking my consultation, working out my recovery patient, doing my sterilization. So although I have two full-time dental assistants that travel with me, the other of the all the offices have additional assistants, that can help. Now, what kind of training? And somebody asked, I've been doing this for 15 years. Don't expect, the assistant to stay the same. One assistant lasted 11 years and decided, wants to be out of the state. A female assistant decided after working with me, she wants to be a PA. And now she's like, I think she just finished her PA school. So I don't expect those assistants to stay for a long time with me. But so far, they've been whatever I have right now, you know, being loyal to me. Now, what kind of training? So both of them, they were dental assistants. They were licensed, registered dental assistants, and actually, they wanted basically to work with me. Initially, what I do is I basically, if I like somebody, okay, come and work with me. Once I decide this person has the capability to be a dental assistant for an oral surgeon, then I myself, even though I have to be honest, I send my assistant for the dance certification, uh, and Aspen Dental paid for it. I did not expect Aspen Dental to pay for it, but they offered to pay for it. Even though it's not a lot of money, a few $100s, but they offered to pay for it. So that was, good from them.
Okay, let's see, another question. Kind of on your schedule and stuff, how many offices are you covering?
So right now and again, this is my own decision. I cover 15 offices, and this is purely my decision. So I can, if I want, I can cover more, or if I want, I can cover less. So, but it's my decision. This is my comfort. I'm happy with what I have. I cover 15 offices.
Any of those offices, two offices in a day? Do you do any half days of oral surgery in any cases?
So, I mean, sometimes I may have, but very, very little, very rare. You can if you want. It's just like I mean, it's tough. I mean, finish squeezing everybody in the morning and then traveling, rushing. I don't think this is, So I've done it, but maybe very. I can count those on my fingers. Very rare. Only if I have to. But I try to go to one office a day, spend the day in one office, regardless if I'm working full time or even half a day. Just I like to go to one office a day.
What about post-ops? Since when you're going from office to office, how do any post-ops or any follow-ups, how are those handled typically?
So this is one of the I wouldn't say the pros or drawbacks, but this is something that kind of like I faced before, and we continue experiencing the post-op. And that's why, as I mentioned to everyone earlier, that I select, I try to do certain procedures that that fits the Aspen Dental Oral Surgery practice. And that's why there are procedures that I'm not doing. So if a procedure that involves a lot of, dissection, let's say, extraoral swelling, bruising, I tend to avoid those ones. Why? Because I like I want to do a procedure that if I cannot come to see the patient the following day, a general dentist can manage those procedures. And so far, for the past 15 years, it worked very well. I mean, a smaller percentage that I have to go back to an office to see this complication. I mean, mainly bleeding, but very, very, very little, percentage. So I work very well with the general dentist. I mean, the general dentists are taught how to do extraction. So they have some kind of experience managing complication related to extraction. Lucky us, in my opinion, I mean, even with an infection, other than bleeding, most of the other complications are very well manageable, unless you end up with a deep space infection. But the bleeding and is the issue, and bleeding comes in from good patient selection and procedure performing. So far has worked very well to me. And as I told you, the general dentists are they have their own experience, and if they don't, I will work on teaching, how to manage complication, whether it's related to my complication or same as they are doing, dental alveolar procedures.
And it's got to be assuring knowing that you've got that referring doc and those GPs, right down the hall from you. Your patient who saw you for oral surgery is, has a relationship with the referring doc, the GP, versus down at another office.
Yes, and this is very, very important. This is very important. That's why, if you want to succeed in Aspen Dental, which, in my opinion, even outside Aspen Dental, it has to be a teamwork. It's not you. You cannot do it in your own. It has to be a teamwork. I don't wake up in the morning and I call all my patients to come to see me or give the instruction. It's actually a team. There is certain people allocated at every office to call patients, confirm the timing, even give instruction. So this is a teamwork. Myself, the dental, the dentist team, the office management, the Aspen corporate. I mean, emergency calls. They receive the emergency call and then they text me or call me if I don't answer within certain time. So this is all a team work that is offered by and implemented by Aspen Dental. So if you are a team person, you'll have much easier experience at Aspen than if you want to be your own boss, or want to work by yourself. But even in private practice, this doesn't work in private practice. And as I told you, I am talking about my own experience with my friends, and I have a lot in the state of Connecticut, and it's even worse to them than, and it's much easier. They all envy me. It's much easier, for me than them. But guess what? In the state of Connecticut, we only needed 2 oral surgeons, and it's already done. So that's why they cannot, they cannot, unless I quit Aspen, or I don't know. And I'm not planning to do that soon.
Yeah, you're right. It is a team from the clinical staff to the non-clinical staff in there. I mean, oral surgery is obviously very important and serious. There's some serious stuff going on, and everything you just mentioned, Dr. Mazid, about the resources and the protocols and the safety equipment, everything in place to support the surgeon and his or her assistants are there in place to support you. Scheduling. How far in advance do you build your schedules out? And another question here: do you do any oral surgery on Saturdays?
So let's start with the Saturdays. Sometimes I do. I mean, like for example, earlier this year there was a day that we had a hurricane and we had to cancel going to this. It was a Wednesday. We had to cancel going to the office, and that office I only, had one day for the office. So in order for them not to lose those scheduled patients, or because most of our oral surgery patients are kind of like qualify under emergency care. So you cannot just say, well, I have to wait until next month, a month later, and then I can. I mean, some of them will wait. Most of them, you will lose those patients. So yes, I did work Saturday. I mean, sometimes like I might have a very busy month, like after the pandemic, it was July. I was shocked how busy I was. I have no idea how. July usually is a quiet month because usually after end of school, very few I mean less people. I usually take my vacation during July. Why? Because it's not that busy. But July was one of my busiest ever. Not the busiest, but was one of my busiest months. So I ended up working literally every Saturday except the 4th of July, I believe, weekend. But I had to work. I mean, it was like busy. A lot of patients were coming, demanding, requesting, demanding treatment. So I ended up working, I believe, 2 or 3 Saturdays a month. But this is my call. No one, forced me to do it. I mean, it just, as I told you, it's a teamwork. It's not about the money. It's not about, it's a teamwork. And if you always keep this, you have an easier experience and time at Aspen Dental. So it's not only me or them. We're all together. Now, what was the other question? I lost it. You asked me
Oh, it was
two
just like
questions.
scheduling. How far in advance do you schedule?
Yeah. So I again, I have no idea how, but I'm really really busy. The end of the year. I mean, I just had to open my February next year schedule. So I'm having patients who are scheduling even next year. So usually I am busy a month to 2 months ahead. December I am already booked for December. So and now we're moving into January. So for elective procedures, I am literally booked, for the end of this year.
Good. Here's a question that I'll actually take a stab at first, and then Dr. Nazif, if you want to fill in with based on your experience with 15 years with Aspen. But the question is, who decides which offices you work at, and is it based on seniority, or does Aspen move surgeons around? I'm just going to say, based on what I've experienced thus far with Aspen, you're going to interview for a position specifically. I mean, the docs and the hiring managers and the recruiters, they're going to be very transparent with you on where the specific offices are located in a specific region that you're interested in, that you're interviewing for. So I can speak to that. But Dr. Nazee, if you want to talk about how it works once you're in the network or in the Aspen supported offices, if there's any moving around or how that might work based on what you've seen over the years.
Absolutely. So as I mentioned about the state of Connecticut with the amount of offices that state has needed only 2 oral surgeons. So that's why I mean it doesn't matter if you're senior or just fresh. I mean there is no other space or offer for in Connecticut. So I'm sure the offers that are available with Aspen is all specific state or area specific. They will know. Now, for example, I want to give you an example. I was talking to one of the VPs at Aspen, and I was inquiring about a specific location and state because one of my dentists who kind of like an associate, not an owner, is interested to move to the state. So I grabbed the phone, I called somebody and one of the VPs and tells me, for example, okay, we're planning on this city and the suburbs to open the next, 7 offices within the next 3 years. So so basically, it's not a state that you're talking about one city and the suburbs that will have 7 offices. This means this eventually this oral surgery position when it's available, it might be only this city or maybe a little bit around it. So every location, state, region demands coverage and depends how many offices available or also the plan how many offices are planned because Aspen before the pandemic they had a pace of opening almost 70 to 80 offices every year. I'm not sure about the pace if it continued now or slowed down. Most likely it slowed down because of the pandemic. But they were doing 70 to 80 offices a year. Means you might have a region where they don't need an oral surgeon now. Next year they might need even 2 or 3 oral surgeons. So it's when you interview for Aspen, the recruiters will mention the regions and the specifics and the availability. So this has nothing to do with seniority. It's whatever you have and the patience. I mean, when I started with Aspen, I started 6 offices, then I jumped to 7, then 9, then 11. At once it reached 22 offices, but I cut down to 15. So every time they open offices, they will give you the option first right to pick it up. If you're a hardworking or a surgeon, they'll tell you we're opening a new location. Do you want it, or should we offer it to somebody else? So it happened. I mean, my the reason that in my situation, because the oral surgeon, the first oral surgeon that took the position at Aspen in Connecticut, his wife passed away, and he just decided to quit oral surgery at the age of 60 plus. So that's why I had more offices available, and I took on those offices until they hired another oral surgeon, and I gave those offices back because I didn't want to do 22 offices. I mean, it was too much for me.
Great. So we're getting close to the final stretch of this 1-hour webinar, and want to respect everyone's time. So if you have any other final questions here, please submit them. But one couple questions that have kind of come up via the chat, specifically around benefits, compensation. You're kept busy as an oral surgeon working at Aspen Dental, and you mentioned the compensation, the percentage, which in many cases you can have limitless income potential versus a salary. But let's talk a little bit about the benefits. Malpractice insurance, any of the benefits that you can speak to, medical, healthcare, and some of those other perks.
So I mean, the benefits, in my opinion, if you look at benefits compared to the income that Aspen offers, the benefit is minor. So the benefit is, in my opinion, is a good thing if your income is low or fixed. And this is what, when I was interviewing 15 years ago, everybody was focused on the benefits. We're going to pay your malpractice. We're going to send you to a meeting once every year. I mean, this is minor compared to your income. I mean, I don't need those benefits if I'm producing, adequate or even very good income. Now at Aspen, so in regards to malpractice, I think the current offer that, and again, I don't want to generalize, but we have issues, so far. I mean, touch wood. When I started at Aspen until now, I literally maintained the same, malpractice cost premium. I mean, maybe it went up, I think, $400 or $500 because I did not, do the online CE that they want me to sit down for 3 hours. And if I do it, it goes back exactly the same amount that when I started with Aspen. But we had some oral surgeons who started with Aspen, and at that time, Aspen, they were generous enough to pay the entire cost of our malpractice. But unfortunately, we had oral surgeons who started with a premium of $60,000. I mean, that wasn't fair for somebody to start with Aspen with a $60,000 of annual premium, and somebody like me who've been with Aspen for many, many years, and my premium is about 15, I believe 15,400. So that's why now Aspen Dental decided, they said, you know what, we're going to pay certain amount of money, for all of you guys, and Anything above that, you are responsible for that. So if you're gonna, how can I say, not respect your malpractice, not do, end up with a lot of lawsuits and complaints, and your premiums start jumping way high. They did not want to be part of this. So there is a limit of annual coverage for malpractice, and anything above that, you will be responsible for it. Now, they do offer health insurance. They do, insurance is, I'm happy with it, compared to, what's going on in this country. But I mean, it's a regular health insurance. I'm not gonna say it's the top of the line or even the worst. It's what's going on in this country and the way health insurance is being run. This is
Yeah.
acceptable to me. And they do offer 401k, which is very good actually. The 401k is excellent at Aspen. There is this coverage. There is optional additional disability if you want, but this is mainly outside Aspen. It's not through Aspen. So kind of like they offer regular benefits, yeah, that other people can offer.
So yeah, so the benefits are there for a surgeon, as you mentioned, but it sounds like the greatest benefit or opportunity is the opportunity to be an oral surgeon, to have complete clinical autonomy, and being paid on a percent of production, so that you can have impact on your income potential.
Absolutely. I mean, as I told you, yeah, one of the advantages about Aspen Dental is it gives you the freedom. You are in control. You know, they will provide you with the patient. They will provide you with the support, and the support is excellent. It just support from all aspects, purchasing, you know, patient care, equipment. We have, want to mention, for example, about ordering my implants. I mean, we have a special section that if I want any implant, if I want an implant tomorrow, place an implant order to be delivered tomorrow, it will be delivered. So the support that I have in regarding to purchasing is I don't think it's available anywhere else. So that's why. So the compensation. I mean, yes, there is. You mentioned the benefits, but to me, is I never looked at the benefits. I mean, they're okay. I mean, they're extra. I'm fine with it, but I don't look at the benefits because I'm focusing on my production, and this is my compensation from my production, and this is the you know this is the main advantage of working with Aspen, is you are working hard or average, but you're really well compensated in according to your production. But I mean, some people will say, well, your percentage, if in a private practice, I mean, you can have it, you can have a big discussion, but for the amount of effort that I have to do, I have to focus on oral surgery, and I believe for what I'm doing, I'm well compensated and well supported.
Great. One last question came in here on COVID. How has the practice changed with COVID, and specifically the resources that have been provided to you to be safe, and for your patients to be safe and your assistants to be safe?
All right. So I mean, as everybody knows, COVID is a new thing that we went through. But I'm talking about Aspen Dental. Actually, I am. They provided me with all the PPEs. So I got the N95 before anybody else in the medical field that I know. Even friends of mine who work at hospital, they had to use and reuse their N95. I did not have to do it because Aspen did provide me with those PPEs, earlier than anybody else, and I still have, a good amount of inventory. So this is like really made my work during the pandemic, piece much easier and much safer. They were generous enough to spend all, the money needed for the office preparation. The plexiglass, the gowns, the head covers, the shoe covers. These are all available. The disposable gowns, the you know the, everything that needed or mandated or recommended, Aspen did make it available. That's why we were able to come back to work much earlier than anybody else. I was back to work almost close to full time end of May. Most of my friends close to June before they went back started seeing patients. And we have actually some offices, like there is an office in the east western part of Connecticut called Danbury. It's right at the border with New York State. The majority of my patients there are from New York because there is a town called Brewster. Most of the senior dentists are closed until now. They're not coming back. So we're seeing most of those patients moving to another state, and especially to oral surgery. I am extremely busy. I hate to give numbers, but I may average. I mean, I'm not sure if I'm right to give a number of production, but I'm really very, very busy in an office that was an average office to me. And now I'm giving them 2 days a month because they just have a lot of patients coming. It's not, even though it's a different state, but I think it's like half an hour drive. But why? Because those senior dentists decided they're not gonna reopen for many reasons. But Aspen is open, not because they're taking risk at their own dentist, because we do have everything needed to continue performing patient care. So the COVID response was absolutely, phenomenal. It's unbelievable. They even, now I am a specialist, so I did not qualify for any PPP loans, but they managed, I believe the story, I heard different stories that all Aspen owners, except two initially, got the PPEs, the PPP loans, and then they went and reapplied for those two who were rejected or did not get it, and then they ended up getting it. So Aspen, through their own finance department, managed to get those loans to all the owner dentists they have. So the response of Aspen was unbelievable. We used to have most of the time once or twice a week of a meeting, a Zoom meeting or audio recording, or and where the CEO or the president of the company will give a live update about the COVID response and the status of Aspen, and he was answering any questions anybody had. So this meeting was for the owner dentist once a week or twice. For the specialists, we started with twice and then we moved to once because it became the same thing. It's just like we're all like waiting for this COVID, and no one knows at that time anything. We still until now don't know much about it.
Yeah.
So that's why we had like a weekly meeting to discuss and answer questions, and not the meeting wasn't to ask when are you guys coming up with the vaccine, but everybody had questions. When am I going to come back? If I come back, am I breaking the state regulations? So the answer at that time was you have to follow what the state regulations. For example, Connecticut came back early. Vermont stayed very, very late. Until now, there are restrictions. Vermont, until now, you cannot perform elective cases. So kind of like, but in Connecticut, we're back doing everything. In Massachusetts, we're back doing everything. So those weekly meeting or conversation were very, very important because you would have different heads of different departments, Aspen, available to answer questions related to all aspects. So I believe we had an excellent support from Aspen during the COVID.
Dr. Z, we're at the fourth quarter here, and time's going out. So I'd like to thank Dr. Nazeef for your time and information and sharing with us on kind of the day in the life of a surgeon, Aspen Dental. It's all the history you provided with 15 years. So thank you very much. To all of our attendees, appreciate you taking some time out of your Thursday. Hope you found the information to be informative. Good to have a good clinical conversation, clinician to clinician. So appreciate your time as well. And Melissa, thank you very much. This concludes our Ask Me Anything session with Dr. Nazeef. So thank you, everyone, and have a good evening.
Thank you so much, Dr. Nazeef.
Thank you, Melissa. Thank you, Ed.
Thank you.
Thanks, guys, for jumping on.
Yeah.
Have a good night.
Anytime, if you want me anytime, I'm fine with that. Yeah. I guess.
Thank you.
Thank you.
No problem.
We appreciate it. We're going to give everyone that was on today your cell phone number.
Absolutely.
No, just kidding.
It's fine with me. It's fine. Trust me, I don't mind.
I know. I'm just
If
teasing.
you have any question, they can ask me anytime you want.
Absolutely. Have a good night, everybody.
You too. Bye-bye.
Bye.